Thank you, Senator. Appreciate it.
All right,
All right, can everybody hear me?
Oh, yeah.
Great. My name is Paul Thomas. I'm a family medicine doctor. I'm a local guy. I grew up on this side of town and went to Grosse Pointe South. I went to my med school at Wayne State, and I did my residency over at Oakwood, which is now called Beaumont. All this to say, I'm a local guy. I really care about this community, this region, and I really want to bring more affordable, more accessible healthcare services to this side of town. Okay, so I wanted to answer that gentleman's question, but he left, so I guess we'll wait for him to come back. Anyways, so what do? I do direct primary care. And what that means is, rather than billing your insurance company for the services that you need, I just ask you to pay me directly, and we save a lot of headaches, hassle, time, energy doing it that way. My company is called Plum Health, and the reason I picked the name Plum is because there's a lot of overlap in my clinic between myself and my patients. I think of that as a doctor-patient relationship. And also, plums are healthy, right? Plum a day keeps the something like that. Anyways, this is what happens in the current healthcare system. When you pay $1, supposedly to your doctor doesn't actually get that dollar. About 40% of that dollar goes to the insurance company, and then about half of that goes to the overhead of the clinic. Now you're thinking, that's a significant amount of money. Well, in the traditional medicine office, there has to be billers, coders, lawyers who are arguing with the insurance company to get that $1. It seems ridiculous, but this is what happens. So these are two parties fighting over the same dollar. Now, a real world example, let's say you have pneumonia and you come in to see me, you're gonna get billed $130. Unfortunately, that $130 gets split up, so the doctor ends up with about $40. Okay, you're thinking, big deal, doctors make enough money anyways, but here's the issue, is doctors start to see more and more and more and more patients per hour, to the point where you're waiting an hour to see your doctor for 5 or 10 minutes. Who's had that experience? You wait an hour, see your doc for 5 minutes, it's a, hey, how are you? Let me wash my hands. Oh, looks good. All right, see you later. That's what healthcare is coming to. I think it's wrong, and that's why I left that practice. I'm now doing direct primary care because I actually get to spend time with my patients. What I do in my clinic is I get rid of all of this nonsense in the middle, okay? And this is how we do it at Plum Health. We get rid of all that nonsense in the middle, and now it's just you and me. There's only 2 people in the room. And now when you pay your $49 a month, I receive $48. I have a 2% credit card fee, or transaction charge, okay? The point being is that we no longer lose money to the middlemen. The money is given directly to your doc, and that's how we set it up. I now have time to actually talk with you, get to know you, listen to your concerns, listen not only to your body, but also to your family situation, some of the stresses that you have, some of the other things that are going on in your life that are affecting your health. And I even have time to make some house calls for some of my patients if the need arises. Okay? A lot of people are thinking, is this legal? There is a line item in the Affordable Care Act that has made this legal, and the best way to do this is to pair it with either a low premium, high deductible plan, so you still have some sort of catastrophic coverage, or you can pair it with a faith-based or health shared savings plan. That's what I recommend. I unequivocally recommend that folks have some sort of coverage in case of a catastrophic event. I'm just going to move this over here so it's easier for me. Also, thank you to Senator Colbeck. He did some great work in the Senate to get this bill passed that makes this legal in the state of Michigan. Not that it was illegal before, it's just that this sets some parameters so that we all are operating on the same page. So you may not have heard of direct primary care before because it's a new thing. There were probably 150 people doing this in 2005, and it's now grown across the country. So the estimate is that there's about 600 people doing this across the country. I'm the only one doing it in Wayne County, and I'm the only one doing it in Detroit. I can arguably say I'm the only one doing it in the metro area. There's another doc, a colleague of mine over in Brighton, so it's about, I don't know, 50 minutes to an hour west of here, but he's doing this as well, and he's been successful as well. So if you know anybody over there, send them over to see Chad Savage with your choice. But for now, we're the only player in town. Now, the great thing about this is because of the efforts of Josh Umbear, who's a mentor of mine, and others in the direct primary care movement, these are the folks who have said, I want direct care. If you go to this website, iwantdirectcare.com, you can kind of plant your flag. And the good news is in Michigan is that there's a lot of demand for this type of service. So I've been operating my clinic, Plum Health, for the last 4 months. We've had a brick and mortar, a storefront. In the 2 months prior to that, in November, December, I was making house calls only. We've gone from 0 people in November to 70 as of today. So we're growing by about 15 to 20 new members each month. I'm really proud of that growth, and that's something that I want to continue. So I like to keep things brief. I don't like to talk a ton. I'm sure you have a ton of questions, so I want to rapid fire, if I can, for maybe 10, 15 minutes, some of your questions about this model and how we do it. Sure.
Do your patients pay you so much a month?
Yes. So kids pay $10 a month. If you're under 18, it's $10 a month. If you're under 40, 18 to 40, it's $49 a month. 40 to 65, it's $69 a month. And once you turn 65, it goes up to $89 a month. So it's kind of a tiered system based on how much you're going to need it over the year.
The reason I'm asking is several years ago, my sister lives in El Paso.
Sure.
And my whole family are doctors. But she said she got into this thing in El Paso with a bunch of her friends. I think they pay like $4,000 a year.
Yep.
To doctors.
That sounds, so the question is, it sounds like some people are paying $4,000 a year. And that gets back to your question. Right. What's the difference between direct primary care and concierge medicine? Right. So in direct primary care, we kind of have a set of rules. We don't bill insurance, okay? That's number one. Number two, our membership rates are between $10 a month and $100 a month. So if you're paying over $100 a month and your doctor's billing insurance, that's concierge medicine. It sounds like your sister in El Paso was in a concierge medicine practice.
She just pays a check $4,000 a year.
Sure, but still I would define that as concierge because it's over that $100 a month threshold. So the most I would ever bill anybody in a year would be $1,200. It's the most, right? So
what's the difference?
The difference is it's kind of in naming. Concierge is more for, I'd say, the 1% or the top 3 to 5% of earners who can afford to pay, let's say, $200 to $300 a month. That's the average. The average concierge cost is $200 a month, and they expect you to carry the highest level insurance so that when they bill your insurance company for visits, they're getting the highest reimbursement from the insurance company. That's concierge medicine. Direct primary care, I don't bill insurance. It's a monthly cost, $50, $70, $90 a month, and it's a known cost, and I'm not, like I said, I'm not billing your insurance. And I have some added benefits. I get you wholesale meds, at-cost labs, and at-cost images.
And those costs are over and above
the monthly membership. That's correct.
Right.
So let's say you take lisinopril for blood pressure. Who takes some blood pressure medication? Let's see some hands. Sure. I typically save people about 90% on their blood pressure medications. Lisinopril you can get at the pharmacy $5 to $10 a month, right? That's typical, right? Lisinopril 10 milligrams costs 37 cents each month if you're taking one a day. Okay? If you're taking simvastatin, it costs 57 cents a month. Simvastatin 20 milligram. Okay, that's for high cholesterol. I have people come in and I often save them, if they're taking 5 meds, I often save them more than the cost of the membership, just on medication savings alone. And that's because I go to a medication wholesaler, the largest wholesaler in the country that sells directly to physicians, and I ask them for this contract and they send me the meds directly. I give them to you without an upcharge. That's how, because my job in direct primary care, and this gets back to direct primary care versus concierge, my job is to deliver the most value as possible. I want to save you as much as I can on your healthcare costs, period. In concierge, that's not really their concern. The concern is about bringing in a lot of revenue. Okay, it's a different paradigm.
Are the services the same though? You might be paying more for concierge versus yours, but at the end of the day, the doctor takes a look at you, diagnoses you, and all that kind of stuff. Is it the same level of service?
Yeah, I mean, yes, it's very, very similar. Concierge docs often limit their practice to 200, 300 patients. I limit my practice to 500 patients, okay? And that's in contrast to the typical family doctor who has 2,500 patients, okay? That's why your visit with your doctor is about 10 minutes, because your doctor has 2,500 patients. They have to see 25 patients a day. That comes out to roughly 20 minutes per patient. That's 10 minutes of FaceTime and then 10 minutes of typing into the chart. So that's where all that time difference comes in.
Well, the reason for that, though, is because they're getting such a haircut from the insurance companies. So in order for them to make the kind of money that you're going to make on 500 patients, they have to see 20 or 40 to 50 people a day.
Exactly.
So,
and that's why we got to get the third-party payers out of healthcare, at least the primary care part of healthcare, and start delivering this. It just makes more sense. Sorry, sir, you got a question back here.
It sounds good, but we know the worst part about medicine is emergency care, hospital stays, surgery. All that stuff is what rakes people to bankruptcy.
Right.
How do you fit into that picture?
Sure. That's why I unequivocally recommend that you carry an insurance policy or some kind of health shared saving plan that you feel comfortable with. Okay? You have to feel comfortable with some sort of, either low premium, high deductible plan or some kind of Medishare savings plan that's going to allow you to live your life and do the things you want to do and not have to worry about those
Even
catastrophes.
under your plan, you have to have insurance for all kinds of extreme hospital situations.
Yes, but here's the thing. If you're paying a platinum plan through Blue Cross Blue Shield, get down to like a bronze plan, okay? Use me for all of your primary care services. Then I can save you money on all of the ancillary services, the labs, the medications, the imaging. Then let's say you have that catastrophic event. How often are you going to the hospital? If it's every year, then yeah, pay the higher premium, lower deductible plan. If you're going once every 10 years, get the lower premium, high deductible plan.
And here's what they found whenever they've deployed direct primary care out there. Because you are getting that access to a primary care physician that you're not getting in your fast food visits right now under primary care with a traditional insurance plan, you're actually decreasing the incidents where you actually go to the hospital, like Paul was saying, and you're decreasing your susceptibility or mitigating the risk of chronic illness. Where this has been tried in the past in other states, we've got Dr. Josh Humbert.
Nobody knows when they're going to have a heart attack.
No,
or
but
chest pains.
actually, actuaries at the insurance companies know, and this is where the difference. Actuaries at the insurance companies know, and here's what's happened. Dr. Josh Humbert has been at this for quite a few years. And what he's done, he started out just by providing a direct primary care plan with the employers on it, worked with some insurers that would help bundle some self-funded insurance plans on it, and then they actually got some traditional insurance companies to come in and do some non-primary care inclusive wraparound plans, if you will, for insurance. They started out by charging them the same thing that they'd charged before, they just took out the primary care part. After a few years, what happened though, is that they started saying, hey, these direct primary care docs and these services are actually lowering the number of claims and the frequency of claims we're getting. So they actually started off by saying, you know what, we'll count your direct primary care service agreement payment against your deductible. So instead of paying that on top, they'd say, hey, if you're in direct primary care, we're going to count that towards your deductible. Later on, they went to the next step and said, you know what, this is still saving us money. We're going to be more competitive if we actually lower the principal associated or the premiums on these insurance payments as well. So at the beginning, insurance companies are going to start out and say, hey, we're just going to carve out the primary care. But over time, what they've done is systematically reduce it. And that pilot that I talked about for Medicaid, that's intended to improve that very fact. If my only outcomes, the metrics that we're catching on that are the number and the severity of claims at the managed care level, so the catastrophic care. If that does not reduce, if that does not go lower, then we don't pursue the pilot anymore and we don't pursue the expansion.
All right.
Okay, so just to make sure I understand, what we're talking about is direct primary care coupled with a catastrophic health plan.
That's the ideal scenario.
All right.
Yep. And to kind of to answer your question, I had a guy who cut his hand on a saw on Friday, and he came in to see me, and I was able to sew up the laceration. He sent me a text message at 11:30. Dr. Paul, I cut my hand. Come on in. I got some time right now. Let's sew it up. So he came in. I sewed it up. I saved him at least $2,000 versus him going to the emergency department, right? And that's a great part about direct primary care. I've built in 3 hours in my day, each day, open, where I'm reading or looking over things right now. But if somebody calls me, I have that open, so you can come in and we can take care.
It depends how bad the injury is. Somebody would call me, I could go to the emergency room.
And the smart consumer would consult their primary care doctor first, knowing that you have my cell phone number. You can call me, you can text me, you can email me anytime so that I can address these problems before they get worse.
I would imagine if he had said that he'd cut 2 of his fingers off,
you'd say, go to the ER. Exactly. And that's the power. And that, and he sent, I can't show you the photo, but he sent me a photo of it. I'm like, okay, I can sew that up. I'm comfortable with that. Come on in. So we got a question in the back.
Yes, okay. In my situation here, I'm a recovery heart patient, so I have a neurologist, I've got a cardiologist, I've got a primary care physician that I'm seeing. You would replace my current primary care provider, is that what you would do?
Sure. So the question is, so we get it on mic, is that you've got a primary care doctor now, and then you got some specialists that you see for other ancillary services. I would replace your current primary care physician, and yes, I could do that for you if you want me to. I'm a primary care doctor, I'm a family medicine doctor. I take care of 80 to 90% of your concerns, and I refer you when you need it. One of the things that I use in my arsenal is this program called Rubicon. So let's say you needed to talk to a urologist about a PSA level or some other issue that you might be having. What I can do is I can send an e-consult to a urologist through my computer and get an answer usually within 12 hours. The average turnaround time is 4 hours. I've done this for many of my patients, and it's free of charge to you. So imagine that if you just had a question about heart medications, we sent that over to a cardiologist about maybe titrating it or changing it just a little bit. Rather than waiting a month to see your cardiologist to see them for 5 minutes, we could have that taken care of through an e-consult. That's what I try to give. I try to give, like I said, in direct primary care, I'm trying to give you as much value as I can. I've done this for dermatology, psychiatry, cardiology, pulmonology, etc. There's over 200 specialists at our disposal that we use together to make better decisions about your health care.
In other words, you could do echocardiograms or what else?
Okay, so
EKGs.
Yep.
Do you do that stuff there too? Or?
So I have an EKG machine, and I can do that for you, and that's included in your $50, $70 a month. I don't charge you for that because the sticky pads cost 75 cents, and the paper costs like 10 cents a sheet. So why charge you $120 for a service that's essentially free? Okay? The echocardiography, I can't do, okay? The echo, but I have a contract with a local cardiologist. He does it for me. He charges me $127. He charges my patients $127 to get that done. But how often are you needing an echo? Every year? Every 3 years? It's, these are decisions that we can make together.
Okay, one more question for
Every 4 times a year, for example, because I've got to be monitored.
Sure. then that's something that you probably want to keep seeing your cardiologist every 4 times a year and keep monitoring that situation. And that's why you would keep your insurance plan that you feel comfortable with. What I'm really offering is better service, the ability to contact me anytime you need me, the knowledge that you're going to save money on your meds, labs, and imaging services if you need them, and the peace of mind that you have a doctor on call for you 24/7, 365.
All right, I want to be sensitive to Victoria because we want to get her in and talk about Puro. After Victoria's done, we'll open it back up for everybody for questions, if that's all right. Okay, so you're not going anywhere yet, right?
No, I'll be here.
Right. Yeah, I'll be here all night. Yeah.
Can I just say you're going to leave your card?
Yeah, I'll just pass them
Excellent.
back.
I got his cards. I can mark them.
Yeah. I've got a young daughter who just got catastrophe and didn't get, and that's a good one. The young kids that
Sure.
don't have a lot
Yeah.
of health problems or no.
A lot of my patients are those who are turning 26 and saying, holy smokes, what do I do? Right? I have a lot of young folks signing up with me.